Risky Behavior by Kelsey Modesto, Sana Lakhani, Taylor Casper, and Tasha Stephen. How does the cognitive development of teens lead to their risky behavior? But first, let's discuss what exactly risky behavior is. Risky behavior can include a variety of actions, such as drinking, smoking, unprotected sex, texting and driving, drugs, and much more. Even though drinking alcohol is illegal under the age of 21, 11% of all alcohol consumed in the United States are from people ages 12 to 20. According to the CDC's 2013 Youth Risk Behavior Survey, 35% of high schoolers drank some amount of alcohol, 21% binge drank, 10% drove after drinking alcohol, and 22% rode with a driver who had been drinking alcohol. Most teens are aware about these dangers of risk-taking behaviors, so why do they choose to ignore all that they have learned? Research suggests that teenagers seek out risk-taking behaviors because the brain systems involved in decision-making mature at different times. The section of the brain most involved in emotion and social interaction becomes very active during puberty, while the section most critical for regulating behavior is still maturing into early adulthood. This helps to explain why certain emotions, peer pressure, stress, and anxiety all hit harder during the late adolescent period. When it comes to depression and suicide, suicide is the third leading cause of death among adolescents and teenagers. The National Youth Violence Prevention Resource Center found that almost 1 in 5 teens had thought about suicide, about 1 in 6 teens had made plans for suicide, and more than 1 in 12 teens had attempted suicide in the last year. Why is this so? Who am I? The development of one's self typically comes from social comparison. Social comparison is the desire to evaluate one's own behavior, ability, expertise, and opinions by comparing them to those of others. James Marshall's approach to identity development can help us to understand the reasoning behind these decisions. Crisis is a period of identity development in which an adolescent consciously chooses between various alternatives and makes decisions. Commitment is psychological investment in a course of action or an ideology. Marshall created 4 categories to adolescent identity. These include identity achievement, identity foreclosure, moratorium, and identity diffusion. Identity achievement and identity foreclosure helps to explain this phenomenon a little bit more. Identity achievement can be summarized as an adolescent making their own decisions based off of their own accord, and identity foreclosure can be seen as adolescents making decisions based off of the opinion of others. Moratorium and identity diffusion are also a part of Marshall's approach. Moratorium is the status of exploring multiple identities without having committed to one, and diffusion is similar to moratorium, but in the end, an identity is not chosen. Low self-esteem is developed from social comparison. In conclusion, self-esteem plays a big role in the cognitive development of teens, which also results in having a role in risk-taking behaviors. Peers have an extremely important role during the adolescent period because peers compare themselves to one another, physically, mentally, and even emotionally. By surrounding yourselves with positive peers, your self-esteem can develop at a healthy rate, resulting in less of an interest in participating in certain risk-taking behaviors.